Joining me now is one man who has been waiting for this day for a long time. Democratic Congressman John Dingell of Michigan, chairman of the House Energy and Commerce Committee. He's the longest serving member in the House, and he has made a career of fighting for universal health care reform. He is a man after my own heart. He loves to fish. And, Congressman, are you going to go fishing now that you got this bill passed through?
I'm going to be doing that and a lot of other good things, but mostly we in the House have still got to finish the task, and then we've got to see to it that this gets off to a proper start. Included in that, we'll be seeing to it that we explain to the people the great advantages and benefits of this and its necessity and how it's going to be good for this country.
Well, what is the biggest thing that, in your opinion, Congressman, after all these years of battling to get some health care reform started in this country, what jumps out at you as something that the American people can grab onto as the most important thing, in your opinion?
First of all, we cover everybody. Second of all, we see to it that every American is going to know that he has or she has health insurance that will be of high quality. Health care is not going to be a privilege anymore. It's going to be a right. And on top of that, we're going to see to it that the abuses of the insurance companies, like not covering people with pre-existing conditions or canceling the policy because you get sick, that will be stopped. And in addition to that, we're going to benefit and protect Medicare. 9 more years of Medicare. The Life Trust Fund life has been extended. We're going to begin to close the donut holes for our retirees and recipients of benefits under the Part D of Medicare. And we're going to see to it that everybody in Medicare is protected in their Medicare.
Well, how big a deal is this? I mean, I understand that the historical moment of it all, President Obama, he campaigned on it. It had its peaks and valleys over the last several months. Speaker Pelosi obviously was involved in getting all of these votes. But from your perspective, you have the decades of experience in Washington. Put this in perspective, Congressman Dingell, on what this really means to the American people, and also how big a opening is there in the door for us to even go further?
Well, I think we've got to first be able to assimilate what it is we have done. But beyond that, what does it do? First of all, it covers every American, 95% of our population. Second of all, it is not only a humanitarian triumph in terms of what it does to helping people, but it is going to solve a massive economic problem. This country is not competitive because of the fact we don't have a program of this kind. And for the first time, our industry is going to be able to compete. Small business will receive subsidies, and discrimination against small business will be ended. Companies like the auto companies that are putting $1,600 into health care into the autos that they sell while only putting $750 worth of steel are going to see to it that they, for the first time, are able to begin to compete fairly with our foreign competitors who do not bear this kind of.
Congressman, great work. Good to have you with us.
Ed, it's always a pleasure to be here. I'm an admirer of yours, and thank you for what you do.
Thank you, sir. I appreciate that. Congressman John Dingell of Michigan with us here tonight. More on health care in just a moment, but